One tip I got from a friend's aunt was, before you start chemo, go and pick out your wig, because you're in better form. You haven't lost your hair at that point, even though I really firmly believed I wouldn't lose my hair. Of course, I'd be the one, But anyway,
you'd be the anomaly.
I'd be the anomaly, exactly. But I did. I went and I picked it out, and, I brought 2 friends, and, we just kind of had a nice afternoon picking out all the different wigs.
So you had a bit of fun at it as well.
Exactly.
With me in studio is Rachel O'Mahony. Rachel, thanks a million for doing this and for doing the Staying Abreast podcast. Rachel is from Cork, but living in Lahinch with her husband Declan. Rachel worked in banking and finance, and she's a photographer and a fantastic, makes a fantastic commitment to voluntary work, and she's very fond of a blow dry. So Rachel, listen, you were diagnosed with breast cancer about 17 years ago. Is that right? In 2007?
2007,
so
yes.
Let's just kind of get into, how did you discover you had cancer?
Okay, thanks, Aileen. I was actually in Dublin the June before, we'd say, I discovered my lump, but I was just up for what we call, I suppose, a medical that my employer was giving us, we'd say, and we could avail of it with our partner. So I decided, you know what, we may as well do this. And it was going to kind of, check everything, and then I'd have kind of a benchmark of where I was at. So while I was at that appointment, then they did a breast check also. And I just mentioned to the doctor that I had some breast tenderness, and he said, look, there were no lumps or anything like that. Everything seemed fine. But he said, if you are concerned, it's no harm maybe to get an ultrasound. So I said, grand, thanks a million. Didn't, left it for a couple of months. And then I contacted my GP, and she said, yeah, I'll refer you for an ultrasound, which I had in August that year. And then I was referred just on foot of that. There wasn't anything sinister, but just onto a breast surgeon. So my appointment was in October 2007. But 10 days before I was due to go to that appointment, I actually found a pea-sized lump on my right breast, quite close to under my arm. I was just, we'd say, kind of itching the area, and then I felt it, and I knew there was something different. I never really had any lumpy breasts in the past, tenderness, but no lumps, thankfully. So,
and how old were you at the time?
I was 38.
Okay.
So it was a shock, I was kind of going, gosh. And I remember we were preparing to go down to Dingle. We go down there a lot. We have a godchild, Beth, down there. So it was the October bank holiday. This was the Thursday night. I had been packing. And when Declan came up, then I said, Declan, look, I think, and he's very calm. And he said, yeah, okay. Maybe give the doctor's secretary a ring tomorrow and see, could you get a sooner appointment. So I rang the following day, but unfortunately he was on holidays the following week and I was due in the week after. So I said, look, I'm going to be meeting him. I put it out of my head, and I went up then and met with Professor Kerin in the Bonds that time in November, and he did a needle biopsy at the time, and he said, look, listening to me, I was very fit and well. I mean, I didn't have any tiredness or any sickness.
And you're a good walker, aren't you?
And I love my walking. I live by the sea in Lahinch. I had been very busy that year because I had actually gone on secondment Irish Life. I had been working in the bank, and we'd say gone, and I was doing financial consulting with Irish Life, and I was on the road between Galway, Ennis and Limerick, driving and meeting clients, and things were busy, but, I hadn't any feeling of tiredness or anything like that I was aware of. And I would be very, I suppose, mindful of my health. Mum was a nurse, so she'd always, say to us, go every year to the GP, get the bloods done. I always got a breast check, when I went as well to my GP. So, it wasn't like I was complacent. I was never complacent about my health, but I had no reason to worry, I suppose, because I felt so good. So
you were having breast checks, right through your 30s?
Oh, yeah. I would always, I suppose, I'll be honest, I probably wasn't the best at checking myself all the time. So then when I went to my GP, I would say to her, I go to a lovely GP in Ennis, Dr. Crowley, I said, will you just do a breast check? Which she always did. So I kind of felt then, comfortable enough, things are good and whatever. So then I had the needle biopsy, and then Professor Kerin said that he would refer me for the triple assessment. So just, I suppose, explain how relaxed I was, he was bringing me in the following week, and I said, well, actually, I'm going to New York. I was going with a group of friends. So he said, we'll go off to New York now, he said, and have your trip. And he said, we'll see you the following week. So I went off, and I did have a bit of a moment over there, all right, that I thought.
A moment of angst, kind of.
Yeah,
is it?
I did. I remember my uncle had died that June, sadly, and we were very close, and he had left me some money, and I went to buy something with it that I'd have always. And I remember just coming out saying, give me the health to, you know, we'd say, enjoy this and be well. And then I said, no, you're fine, and went on. And then we had the triple assessment, and that included the mammogram and the ultrasound, which were both clear. So then Prof did the core biopsy after those on the same day, and, you know, left, and it was coming up to Christmas. It was the end of November. So he said, look, I'll send you out the results, but, you know, have a lovely Christmas, and went off.
So at that point, did you feel there was something there, or were you reasonably confident?
I was reasonably confident, and as was he, because mammogram and ultrasound were both clear.
Yeah.
And
but you had found the tiny lump.
I had found a tiny lump, all right. So there was something there, but it was just to find out, I suppose,
what it was. Yeah, it could have been a cyst, it could have been anything.
Exactly. Yeah. Or was it, you know, I suppose sinister or benign. But I really, I said, God, please God, everything will be okay. But I just felt well. So then I got a call on the 10th of December, and it was to come up and meet Prof in the Bonds here in Galway, and to bring Declan. So I kind of knew we could be in trouble, and I went up that evening then after work, and Declan was very calm. He said, we'll wait now and see. So we went in, and Prof said, you know, they did the tests and the core biopsy came back, and unfortunately, you know, there was cancer there. So
what was your diagnosis?
My diagnosis was, we'd say, stage 3 HER2 positive breast cancer. And I didn't really get all that then. You know, it was breast cancer because they had to do further tests. Yeah. And he said, look, Rachel, it looks small. So he said, what we're going to do is we're going to bring you in next Monday, which was the 17th of December, and you'll have surgery, and, you know, I'm going to look after you. And I'll be honest, it was like an out-of-body experience. That's how I would describe it. Because you'd hear people talking about different things, and I felt exactly that. I felt like I was just watching. Declan got so upset, who was very calm and collected always.
In the office?
In the office. And I'm like, I'm the emotional one and not Declan. And Prof, you know, I was just looking at it, and disbelief, I think, really. And I didn't cry, which I couldn't believe. I was very kind of calm. But I think it was just overwhelmed maybe. And so was it explained well to you? Yeah, like he did. He just said, you know, this is what we're looking at, but I had to go for further MRIs to really get into the nitty gritty of it. And when you say Prof, you mean Prof Michael Kerin, was my breast surgeon. Yeah, a lovely man. And I still see him once a year now, every, we'd say, March for my mammogram and a consultation. And he's just been so kind and good. And, you know, I think, very much at ease with him from the get-go. He's a Clare man. So I suppose that's, you know.
He's actually on this podcast.
Yes, I saw actually yesterday on Instagram. Fierce, nice, and very personable, and always remembers, you know, we've 3 cats, and he, you know, loved Declan, and, you know, just as I said, I felt I trusted him from the outset. So he said, look, it was kind of lumpectomy. That was what the provisional was.
So that was the treatment that was being offered to you?
Yeah, but then, as I said, I had to undergo an MRI then that week and some bloods and things like that. So when I returned on the following Monday, the 17th of December, then to go to hospital. I was having surgery on the Tuesday. It was actually a mastectomy that they were proposing because...
And was that a shock, Rachel?
That was a shock now, I'll be honest. I think
Was that the first time that you kind of really reacted?
Yeah, I think so. I just went, gosh, I think I could probably cope with lumpectomy because that was taking a piece out. But mastectomy, and I'll be honest, I remember, years ago, people would talk about having the breast removed. I'd hear my mother maybe speaking about it, and you just have this awful, awful image in your head. And that's what came into my head, and I was so scared. Gosh. And I was shown these images then, because they said, would you like to have a reconstruction? Sure, all this was a whole new world to me. I was going, reconstruction? What's a reconstruction? And
And this is only a week after you'd heard the initial news.
The initial news. So it was, because they were preparing for surgery, and So I said, look, will I wake up the same tomorrow morning? And anyway, they said, you know, yeah. So I said, look, I'll go with it. So really, in a lot of ways, maybe it was the best because it was whirlwind. I didn't have that, I suppose, waiting that a lot of other patients have, you know, between tests that they don't know. They know, but they don't know. Whereas mine was, I was diagnosed Monday the 10th. I was in hospital on the 17th. So it just happened really quickly. And I think I'm glad of that, really. And I had the surgery and the reconstruction, and I did very well.
So it was an immediate reconstruction, was it?
Yeah, it was on the day then as well. So they kind of take, now I don't know the ins and outs, kind of muscle from, we'd say, around my back and under my arm to reconstruct. So there was a bit of recovery in that because my arm was definitely, you know, slow to lift it. But they go through physio exercises with you in hospital, and I was there for the week and I came home on Christmas Eve. And I mean, he said he'd get me home for Christmas. And I did. I got home and, you know, so, and I was very well looked after there, to be honest. And
just taking a step back there, how had your family and friends reacted at that point?
They were in shock.
Yeah.
Yeah, they were really, because like that, you know, there was no, I suppose, symptom and just no warning.
And was it in your family?
Now, we'd say my aunt had died in 98, so 9 years before that. She was only 54. Now, Auntie Mary had a very bad chest infection, never ever sick in her life or missed work. She was working, living in Dublin. She ended up in hospital, and in 5 weeks, sadly, she passed away, and they discovered she had secondary cancer in her lungs after 3 weeks. They never found her primary, and she got no time. And that was an awful shock to us. Like, she was my godmother and my only aunt, and, you know, so we never knew what her primary was. Yeah. And but as regards breast cancer, no, there wasn't. We'd say my grandmother would have died at 84. She had stomach cancer, but, you know, she was a good age, really. And it didn't, I suppose, it was a slower kind of cancer. And, you know, she wasn't, thankfully, so ill with it.
Yeah.
But
so breast cancer wasn't something that was kind of on your radar?
No, not at all. I mean, again, I suppose my uncle had passed away that June previously. He had a form of leukemia, and he was 66, so he was young as well, you know. But as I said, no, not breast cancer. And so that was, you know, I suppose, very alarming. And then I have 2 younger sisters, so, you know, you're kind of ensuring then that they get checked and that. But I suppose we'd say once the surgery was over, I had 6 weeks recovery, and I met with Michael Kerin, then a professor here in Galway.
So how did you get through that Christmas?
Actually, do you know what? I was very good. I think, again, I was in a bit of disbelief.
Yeah.
I was.
This had all happened very quickly.
It did, and I kind of said to Declan, I wonder if they've made a mistake. Because you know what? I feel so well, you know, you never know. And he goes, no, I don't think they've made any mistake, Ray. But maybe that was just me trying to manage it, because, you know, I remember that Christmas, Joe Dolan died on Stevens's Day.
Gosh.
And I recall my mum loved Joe Dolan. And I remember saying, my gosh, you know, will this be me? You know, I did, you know, I went there a little bit, but then I stopped and I said, come on now, Rachel. The one thing I'd say that the diagnosis did, it stopped me in my tracks. I stopped planning beyond the day I was in. I'm a planner. I'm always going. I'd every weekend laid out. Declan would say, where are we in 2 weeks' time? And, you know, I connect with a lot of people around the country from friends I've made over the years, traveling around to different and living in different places. And I am just go, girl. Yeah. So
your weekends were mapped out, all the rest of it.
Everything, you know, and holidays. And I had a great time. You know, I really did have a great life and appreciated it always. And
so you just had your New York girls trip under your belt.
Yeah, that's it, you know, and like, you know, we were always plotting and planning, and it was great. And it was young, and, you know, that's what you do. And we'd say, and have the health to do it. So I suppose this really made me much more mindful. And I often say, Ray, if you could go back to that, you know, just staying in the moment more so, because, you know, you do go back to thinking
back to
ahead.
The day,
you do,
hectic, frenetic.
Which is good too, because you want to get back to normality.
Because that's who you are.
Well, that's it, exactly, you know, but it stopped me. So I just lived for the day I was in. And then I think when I met with...
So it was 6 weeks, you said, after the surgery?
6 weeks, yeah. I then went and started chemo. So Professor Kerin, I met him in January, or my chemo began in February that year. And he said to me, look, this is the proposal: chemotherapy followed by radiotherapy and a hormone therapy. So he said, also, you are eligible for a clinical trial. And I didn't know anything about clinical trials. You hear about them obviously in the media. And he went through the protocol along with the clinical trials, Nurse Bernie at the time, and just explained everything and gave us a lot to go home and read about as well. So we said we'd have a look at it and consider it. And it was trialling a drug called lapatinib, which had been used on patients with, say, what we call metastatic cancer. So they were trialing it in patients like myself with cancer for the first time, just to see would it reduce reoccurrence. So we thought about it. Declan was my research man. I didn't look up anything. I didn't Google. I just said, no, I don't want to know. I'll deal with whatever I have to deal with as it happens.
Yeah.
Declan did all the research, and that was his way too of, I suppose, how he could manage it.
That was his coping mechanism.
And he's very good at all that. And so we had a discussion and said, okay, we'll go with the trial. So I began chemo on the 4th of February. So what my chemo regime was, every 2 weeks for 4 sessions. And then I would go on to weekly chemo for 12 weeks. And then I'd start taking the trial drug along with the chemotherapy. So it was an ALTO study. It basically is your standard care, and they bolt on a new drug to see, will this actually, make a difference to patients. So
I suppose for you then, you're still getting the care that and the treatment plan that you would envisage. It's just, as you said, there's an additional element to it. Exactly, with the trial drug. But the advantage, and this is what I would say to people, make sure to talk to your clinician, your oncologist, find out about trials. I'm passionate about trials because you are getting an improved standard of care. That is a given, because you're actually, we'd say, have a dedicated clinical trials nurse, which she will liaise with you for every visit. She coordinates you get extra scans, because they obviously have to monitor you closely because you're on a trial drug. So if there's any changes or any reactions, and that was my concern, because I said, what happens if I react to it? You are immediately taken off it. If you decide even yourself throughout it, you don't feel comfortable on the drug and you want to pull from the trial, you can do that. So, there was flexibility in it. Yeah, so very close monitoring.
Very close monitoring. And that gave me great reassurance and great security.
So just going back to the point you made there, so would you say to anyone who is, facing a diagnosis or has just got a diagnosis, to ask whoever they're dealing with, their medical practitioner, to talk to them about clinical trials to see if they are eligible and what's out there?
That's it, because see, and I know they do a campaign as well with the Irish Cancer Society. It's called the Ask. They brought that out a number of years ago, but just because it isn't often maybe mentioned, it depends on your oncologist, whether he's involved with research. Professor Keane was, as is Professor Michael Kerin's, fantastic. So they had trials available in Galway. But, even if it isn't available in your hospital, there might be an option somewhere else. And, it's just to talk about it. What I'd say is a trial isn't for everybody, but get the information and at least you're making an informed decision.
Yeah. So have all the information in front of you, see if it suits you, see if it's something that you're eligible for, and then make the decision after that.
Absolutely. That's it for sure. Because, there's so much research being done in Ireland, and, that research is being transferred into trials. And I suppose
those trials, obviously they're an additional benefit to you if they work.
Yes.
But obviously if they work, they're also an additional benefit to everybody else.
See, that's it for people coming behind. And also, I think of all the ladies, and I know men are involved in drug trials as well, and men can get breast cancer, to be aware of that as well. But, all the drugs that were trialled on those people and patients that, are now were available to me then, so So
somebody had gone through a clinical
trial for those, so, and I got access to those then. So, and I suppose you're worrying about yourself. Obviously you're saying, I want to be well and I want to get better, and you're afraid and nervous, but as you're so closely monitored, that gives you that reassurance and the care.
As you say, you can opt out at any stage.
You can. So that's very good too. And also, if for example, the trial didn't work out or you opted out, you're still within the trial. So you'll still be monitored. I was monitored for 10 years. So what happened with me was I had my first 4 chemos. Then I had the 12 weekly with the trial drug. So after a couple of weeks, there was a bit of a change in my bloods, because your bloods are done every week when you go for chemotherapy. And they took me off the trial drug for a week, just to see what things, we'd say.
Was that what was affecting
causing
your bloods?
the bloods?
Yeah.
Exactly. So went back the following week, bloods were okay. So I went back on the drug again. But after a couple of weeks again, it was affecting kidney and liver. And it was actually something that seemed to be affecting patients there. So we'd say they decided, look, you'll come off the trial drug, but now we'll put you on another arm of the trial, we'd say, which was Herceptin, which was the tried and tested drug. So Herceptin would have been the standard care. So I went on to that because I was upset. I was saying, oh gosh, now, I've had access to this now and now I don't. And they said, no, don't worry, because you were still getting Herceptin. There was no placebo in this, because that's something that people would worry. I wouldn't go on a trial if I thought that I could be the placebo and I'm not getting anything. There was nothing like that in this trial. There was the standard care, and then they had different ways of, we'd say, administering the trial drug. And the one I was on was the trial and the chemo. So I just went then from the trial drug to Herceptin. And Herceptin, again, is a targeted therapy, which is another very important thing, because it targets your specific cancer. And this is what all the research is aiming towards, that we will have more precision oncology, so that for Rachel, her cancer is different, say, to Aileen and my body and how I react. So we can make it more precise. So targeted therapy, which I suppose was a new departure from, chemotherapy was kind of the one size fits all.
Yeah. And I think a lot of people probably who haven't been through breast cancer probably do think that there is a one size fits all, that it's, that the treatment plan is the same for everyone, that it's, chemo, possible mastectomy or lumpectomy and radiation. And, I think people assume that's the pathway, and it's not necessarily the pathway.
No, it can be very different. And really your cancer, I don't think I've met anyone who has had the exact same cancer. We'd say it can vary. And, I suppose these targeted therapies, those type of drugs, they have the Herceptin for breast cancer. They may not have it for other cancers, we'd say, but it targeted that along then with the chemotherapy. Because I suppose the chemotherapy is I found it grueling, I won't lie. Found it tough, it was tiring, I was nauseous. Fantastic to give you anti-sick drugs and steroids to help you. But we'd say, it isn't easy. So the more research... Did you
lose your hair?
I did. I was.
How
they told
were
me
you?
It would be after my second chemo. So I got a very good tip. As I was saying, I think to you earlier, the tips and tricks and the little bit of practical advice are very handy, because we know that our medical team will look after our medical needs and leave it to the experts. But it was small things really helped me.
So this is the Rachel Recommends section of the podcast. Yeah. So Rachel, what do you recommend in terms of practical tips? Give it all to us.
Well, what I suppose tips I got, and then what I learned myself from my own experience. But one tip I got from a friend's aunt was, before you start chemo, go and pick out your wig, because you're in better form. You haven't lost your hair at that point, even though I really firmly believed I wouldn't lose my hair. Of course, I'd be the one, but anyway.
You'd be the anomaly.
I'd be the anomaly, exactly. But anyway, I did. I went and I picked it out, and, it wasn't, I brought two friends, and, we just kind of had a nice afternoon picking out all the different wigs.
So you had a bit of fun at it as well.
Exactly. That's
and were you trying to replicate your own hair as a matter of interest, or were you going to go for
it was
something
very
different?
similar. And you see, that's another reason, go before you lose your hair, because they can see what your hair is like, and they can, match it as closely as they can. Now, some people decide to go totally differently. I went a bit longer, because I said, sure, look, I'll go with a bit longer. And then during my treatment, I got a cut a bit, we'd say. And I mean, back then in 07, 08, the wigs were good, but they're fantastic now, but we'd say, like, that was great to have that done.
Well, and I think that's a fantastic tip for any woman to make, to go while they have their own hair, so that they can, so that, as you say, the hairdresser can see exactly what your own hair looks like and what your head looks like.
Exactly, that's it. And they're I went to a place in Cork. I actually came back to Cork, we'd say, for the wig. And, they were just so... They were used to meeting, I suppose, clients who were going through a cancer journey. So they were just fierce nice, and they knew what they were doing and the whole lot. And so they said, contact us, when you want us. to fit the wig for you and all the rest. So they were very nice. And the other thing then wasn't available at the time. I would have loved if it was the eyebrow tattoo. Things like that at least, because I suppose when you lose the hair, you have the wig to fill that gap. And losing your hair isn't easy. But once it's gone and you have a good wig and you have lovely hats and scarves, you become very creative. And, we'd say, and you just get on with it. And I'm very lucky my hair came back. I have good thick hair and I was very, and it does come back. It does, and you worry it won't.
Fantastic head of hair, to be honest.
But and I always, I suppose, had, thankfully. But
and what about the eyebrows then?
The eyebrows then, I didn't get them tattooed because they sadly didn't have it at the time. I just had to kind of fill them in as I went. But now they have, and someone I know recently has got her eyebrows tattooed in advance of her chemo. And those kind of things, if you just feel, a little more normal, I suppose, look, we don't want to look sick.
Yeah.
And
I think presentation is a lot, isn't it?
It is really.
Feeling that you look like yourself.
Exactly. That's it. Because you lose a lot of yourself during this,
And did you feel, that you'd lost a bit of femininity, between, the mastectomy and the hair and all the rest
suppose
of it?
with the mastectomy, because the reconstruction was excellent, I have to say, it really was. And I woke up, kind of that night and you're sort of nervous. You're saying, gosh, I was bandaged, but we'd say, I had 2 breasts. Now I'm very small breasted, so we'd say, for me, even though I know now they do recommend having reconstruction later because you do sometimes get, we'd say, impacted by radiotherapy. It can form a capsule. So it's kind of preferred now that you leave it till afterwards. So a lot of people I know since have gone for reconstruction later on, we'd say. But, for me, it worked out very well. And, I was very, very pleased. And I felt like me, we'd say as well when I woke up. In relation to the hair, once I got the wig and I had the blow dry look, and it's funny because I was out with a friend in Lahinch about maybe 2 months into chemotherapy, and we were having a coffee, and a former customer of mine from the bank, and she was an American lady, I hadn't seen her for ages, and then she come up to me and she said, "Oh, Rachel, I love your hair. You've let it grow." And she wouldn't have known anything. And I was like, "Thank you very much." And then Katrina said, "Well, now, isn't that now validation that your wig is a good one and no one knows, Rachel? Not that you're hiding the fact, but on my good days, I wanted to go out and feel myself."
And you don't have to, tell everyone your story.
Exactly. That's it. And I'm probably better at speaking now, all these years on, but at the time I was very private about it.
And there are probably days that, that you can be very open, and days that, you just want to feel like you are the same Rachel that you had been prior to diagnosis. That's
it, exactly. And I mean, to have the wig option is fantastic. So, it's things like that and just practical things, that, as I said, like different things around sickness. Another friend told me about kind of something from the health food shop that would just help, things. I remember pineapple for the taste in your mouth. It's just small little things.
Yeah.
And
so you were sick then with the chemo?
Yeah, I did. I found the first week very hard. And then the second week, it was like the fog lifted. And then I would kind of be ready to go out again and maybe meet a friend for coffee, go for a walk.
So that's the pattern.
That's the pattern for me. Yeah. Now, I'd say as well, another, we'd say recommendation, have a notebook and record how you are each day, because also you have to meet with your oncologist, maybe the registrar doctor on your chemo day. And on your chemo day, you're very good because you're 2 weeks from your previous chemo day. Exactly. So, and Declan would say, don't forget, because you'd go in, I feel fine. But having it in my little diary, I could say, well, on this day, on that day, or whatever. And also, so they knew how you were feeling. So then they could give you extra whatever for those days. Plus, I was able to work out then my pattern. So I was able to say, because after the first one, you're very nervous. You're saying, God, am I going to be like this?
Yeah.
Is this going to be it now for 6 months? But then you say, oh no, day 8 now is actually, for me, day 8, I kind of was like, whoa, okay, here we go. And, you just felt a little bit more yourself and a bit more energy. So then I knew I could prepare and say, okay, Rachel, first week is a write-off. That's okay. Stay in bed or lie on the couch. And met a lovely lady, a friend of ours' mum, while I was recovering from the surgery one day on the pram, and she'd been through cancer a couple of turns, and she was so nice. She said, Rachel, what I'd say to you is do what you want to do what your body, listen to it. If you want to close those curtains and just lie on the couch, don't, don't try and do everything and kind of say, oh, I'll be normal. I'll be like, I felt I had to commit to it. And I think that was when I kind of accepted it, that I said, okay, Rachel, this is it.
Yeah.
You're having chemo. This
is something
chemotherapy.
I'm doing.
Yeah.
So I don't have to, support everybody else. And, I think sometimes maybe people feel that if they're acting normal, that'll help their family or their friends.
That's it. Because you know how you're feeling as a patient, but your loved ones don't. So they're looking and they're willing you better and they're worrying about you. But you have to just say, okay, I'm going to accept it. I'm going to accept the chemo is going to help me. And my husband used to say, well, at least we know it's working. When I was sick, and you're losing
That's
the
a
hair.
sign. That's a good sign.
A good thing. It's working. And
Yeah.
I'm like, okay, yeah. As I said, he's a great, he
Yeah.
was so good.
Great way to look at it.
Yeah, and a good bit of humour, you need it because in fairness. So, and then I just got into my routine and said, okay, these are my days, my down days, and that's okay. That's fine, Rachel. And then you'll be ready for the world.
Yeah, as you say, close out the door.
Close out the door and do, a text. I always say to people, text someone who's going through anything. It needn't be cancer. Just, something in someone's life that is, has changed for a time. When you get a little text to say, because I didn't feel like talking so much, and you get
texting is kinder, isn't it?
It is, and it's like thinking of you. And I just say,
and that's all you want, because you don't have to respond necessarily to a text.
Exactly. And you just kind of go, gosh, that's really nice. Or the cards. Oh my God, Aileen, I got so many cards. I got so many flowers. I was just it's just incredible what people do. The kindness.
The support, yeah.
Oh, the support.
Yeah.
Like family, friends. Absolutely amazing.
What about dinners at the door?
Pardon?
Dinners at the door.
Yeah, just so good, anything and everything. And just, people are. And, you really, it restores your faith in humanity. You just say people are so good. And that's why, I suppose, these tips and tricks I like to share with others. Informally, I've been kind of connected, or, people have reached out. I may never have met these people. I might just be on an email to them. But as I said, these are things that help me, or I found helpful. Everyone's experience is individual. But, it's just any way you can help, because I appreciated it so much, and it is hard to ask for help. I wouldn't be someone, I like to kind of say, right now you're tough. And
well, you're Irish.
You'll do it. Exactly. Yeah. We're kind of just, dig down, dig deep and, get on with it. So, but as I said, it's,
But would you, in your Rachel recommends, would you say to accept as much help as you're being offered?
Absolutely. Oh, accept it, and don't be afraid to ask for it, because people want to do something and they don't know what to do. They don't know what to say.
I think people feel worse if they can't help.
They can't help, exactly. Yeah. So whatever it is, accept it. And I mean, I suppose in our situation, we have no family. It's myself and Declan. We'd have loved to have had kids, but that's the way it went. But so I was very lucky. I was able to dedicate the time and just rest. I mean, I've had friends who have had smallies and they've to get up for them, and they don't want them to be upset and they want to keep their normal routine. So it's really challenging, but so, accept the help when it's given. And as you say, people are only delighted to be able to help out. And also those supports. I mean, the Irish Cancer Society is just an amazing resource. Going online, that wasn't really available in the same way, I suppose, back in 2008. Now, there is just so much information. There's others sharing their story. There's the helpline. There's counselling. And I would say, I wasn't really kind of ready for any counselling or anything at the time of my treatment. I just said, look, we'll get through this. Throw the kitchen sink at me. I don't want to be back. I'll take what I have to take. And then I had my radiation after the chemo finished. And I went to Inisheven here in Galway under Cancer Care West, which was just like a big comfy blanket put around me. They would say have some 33 rooms now. They probably were a little bit smaller in 2008. They hadn't opened long, but they are a service that are, we'd say, onto the hospital grounds, but they're not the hospital. You get to stay during your radiotherapy, because it meant I didn't have to travel up and down each day from Lahinch, because that's...
So you stayed there the whole time?
I stayed there for 5 weeks. Well, of course, Rachel decided at the beginning, no, I didn't go in and look at it. They offered me the option. I said, no, I'll do my own thing, thank you, because I felt it might be hospital-like, and I said, I don't want to be feeling I'm in hospital. And I ended up, a friend of mine through the bank booked me into a hotel. And I said, because friends offered to, we have friends in Galway, but I said, I need my space and you need your space. You know what I mean? You don't
So
want
you
to
didn't want to be staying in somebody else's house.
No, I said it wouldn't be fair on them, and I
Yeah.
felt it would just give me my own space too.
Yeah.
So I had a week in the hotel, and on the Friday of my first week of radiotherapy, I met a lovely lady that I had met through the chemotherapy earlier on that year, and she said, "Why are you not in Inisheven?" And I said, "No, I don't want to go there now because I felt it might be hospital." She goes, "No, come on over with me." So I went over and I walked in. I went, "Oh, this isn't." It was like a boutique hotel.
Was it?
And I was like, "Oh," I said, "this is lovely." And I met a lovely nurse, and she said, "Look, Rachel, I will give you a ring. I'll see what we can do, and get you in for next week." And I said, "I'm so sorry that I didn't actually come over and even check it out." So that's what I'd say to patients as well. Check it out. They give it
be open to it.
Be open. That's it, exactly. I was closed going, no, no, no. But once I walked in there, and then they rang me, and I went in on the Monday. So I had 4 out of the 5 weeks in there, and it was marvellous. They are there as a support. They're not invasive. You have your own room. 2 beds. Declan was able to come up during the week. I had a friend from Dublin came. I had a friend from Kerry came. I had a friend from Cork.
Rachel, that is fantastic.
But it's like that support and resource, is it?
Yeah.
And it's all free. Like you, like we'd say, we did a fundraiser, myself and Declan, then through my birthday. I was 40 a couple of years later. So we fundraised for Cancer Care West because they were amazing. And all my friends were so generous, we'd say, in donating. And you donate if you want at the end of your visit, we'd say, because like what they did, it was just that support. I mean, they had counselling, which I did attend, because for me, it was like it kind of hit me then, it was sort of the reality.
I suppose with something like that mightn't be for everybody, but you need to open your eyes and see what's there. And possibly it will suit you.
Exactly. And
did you bond with other... or did you do any of that?
I did, because in the morning we had breakfast and we had tea there. During the day, you could go out for dinner. So I'd often go for my radiotherapy at lunchtime, and then I'd take a walk into the city, because you're very close to the city from the hospital, and I'm a dinner girl, and have my dinner and then come back. And they had little events on then in the evening. And there was a lot of actually, I suppose, older men had come down from Donegal and Letterkenny. Like the area that we'd say University Hospital Galway covers is unbelievable. And the fact that these, we'd say, patients were able to stay, because if they were to be bussing up and down,
fantastic,
it's fantastic. And one man was so nice, and he said, "Rachel, I've been so content here," he said, and he lived alone, and he said, "I'm going to be so lonely when I go back." And I was saying, but there were supports up there, and I said, "Make sure now that you go in, and call in and things like that." But they were wonderful, and we did a few courses. Declan came up, and I did a mindful course. Like, the services, amazing. And you can still go to they've opened a separate unit then the following year, and they have, we'd say, for people to come in and have, like, I unfortunately got lymphedema after 6 months after my surgery, which is something you can get when your lymph nodes are removed. And they do manual lymphatic drainage there. They do massage. They have counselling. If you just want to go in and have a cup of coffee and have a chat, it is just fantastic. It really is. And we're very lucky. Now, I know in Cork they have ARC. They have different services in different
but I think it's just
cities
wherever you are.
Yeah.
Look
and find out what's available.
Be open to it
and the hospital will tell you as well. They will probably give you some information, but they are very busy in oncology. It's crazy, and they're doing a wonderful job. But just, I suppose, we've so much at our fingertips now through the phone. Just Google it, look it up, and find out what's there. And I suppose be open to it, and open, I suppose, at the time is best for you. As I said, it was more afterwards I availed of it, and because there are just amazing resources, and there is, I suppose, a listening ear, and the Irish Cancer Society will say it. You're going through a cancer journey, but they want to ensure that you're not alone, because it is lonely. You're kind of, you've to do it. Nobody else can walk in your shoes. You've to just get
no
up
matter
and
how
face
much support and everything else that you get. It's still you. It's
still you, and you're fearful, and it's scary. And I think there'll always be that little, I'm never complacent, a pain or an ache. But the longer I'm well, I say, gosh, and I'm so blessed to be.
So when you finished the radiation then, where did you go from there?
So that finished then in September 2007, and then I continued going up for this Herceptin drug. Every 3 weeks was the regime then until March 2009. So I finished that. For me then, I had so lots of tests done with the trial drug, the follow-ups. And I also had this bone strengthener because I had some osteopenia, which can happen with some of the drugs. You can get side effects. So I continued getting an IV of that 6 monthly for 10 years. So really in 2018, I finished what I'd call, and I was on a hormone therapy as well. So I was taking, we'd say that was just an oral tablet I took on a daily basis. And that can change then depending premenopause, postmenopause, because that's another issue. You know, it's a medical menopause initially when I went on chemotherapy. Then sadly, Mum was diagnosed with ovarian cancer in 2010. And Mum was 67. So she unfortunately didn't have a good prognosis. So she passed away 7 months later. They gave her some palliative chemo. But on foot of that then, they kind of said, you know, ovarian and breast, there can be a link. We didn't have my aunt's primary cancer. And maybe
so that question mark is always there, isn't it?
So I was tested then for the BRCA gene, and thankfully I was, you know, there was no gene there.
And your two sisters?
And they haven't been tested, but we'd say they said they might look at it, but I think it was just, you know, I was unlucky. It was kind of a hormone, I suppose, cancer I had. So basically then it was decided that I would have my ovaries removed. So I had an oophorectomy.
And was that a decision you made, or?
With the oncologist, I kind of spoke to Mac and Kerin.
Just kind of under the best guidance.
Yeah, exactly. I suppose with Mum's history, and then it's just another precaution. And I suppose at that point, you know, we weren't having family, but I found that very difficult. I really did. That was really, really hard, because I suppose there's always hope. But there's no hope when, you know, you have that surgery. But so that was a challenge. But
so that was only
2011. I had that surgery.
So 4 years after
the, let's say, the breast diagnosis, and then that then was another, like we'd say, surgical menopause. But that's the one thing I think was missing for me. There was no awareness really around menopause back then. It's only in the last couple of years it's come to the fore now, and there's much more openness. But I was kind of hurled into that, and I really didn't know whether it was just side effects, it was just me not feeling myself. You know, it was, but it was a lot of menopausal symptoms, obviously hot flushes, sweats, things like that. And I was young, so none of my peers were going through this. So I found that very tough.
You found it tough, the symptoms, and also the fact that it wasn't...
I felt there wasn't any information on that. That's something I think they probably give much more guidance on it now, that after, you know, if you're, we'd say, if you have a medical or surgical menopause, you know, you're going to like have these symptoms. And I suppose now I can't have any HRT, obviously, because of the estrogen issue. But, you know, there are other things that you can look at.
I mean, and again, going back into your Rachel recommends.
Yes, yeah.
I mean, is there anything you'd say to somebody who's, you know, in surgical menopause or medical menopause?
I would say to them, I suppose, discuss with their medical team, you know, how will that affect you, or where can you get the information?
Prior to going into it, or while you're
I suppose maybe when you're, you know, either way, because I really didn't get a lot of info on that. And that's, I didn't know really what I was, you know, I said, is it just, Rachel, you're just not feeling well after, you know, because it just really, it was a big impact. There was a friend of mine in the bank, she's a bit older than me, and she was going through menopause. And I used to say, I'm so hot, running upstairs in between customers. And she says, you don't look half as hot as you feel. And she was the same, like purple, you know, we'd say, and like she would have been 15 years older.
Yeah.
But
so thinking that she was glowing red.
Yes, yeah. I thought I was glowing red. And she goes, you're not, Rachel. And I said, I feel it. I'm the sweat, you know, and you're in front of a customer and you're just conscious of it. And I suppose I didn't have anyone.
So it's just to be more informed.
That's it. Yeah. Just that, I think. And the lymphedema is the other one. I'm really passionate about lymphedema and you know, preventing it.
And what would you say, you know, that may work towards preventing something like that? I suppose
more education, I think, you know, through the hospital, knowing more about lymphedema. I suppose the good thing is, right, that we are now surviving. Women are like living beyond breast cancer, whereas in the past they didn't. So we didn't know about the side effects. That's it. So now they're realizing, okay, there's lymphedema, there's, you know, whatever it is. So it's a good thing we're we're living, but we want to live well. I don't want to be left in a heap on the couch and say, your cancer is gone, congratulations, but I can't do my norm. I want to come back to society. I want to go back to work. I want to be Rachel again, planning and plotting. I want to, contribute. And if these side effects are so debilitating, that's why we need the research. We need the precision oncology. We need the clinical trials so that we sometimes don't need full chemotherapy, and they have now ways of finding that out. You can get, we'd say, I don't know the term, but, a blood test to see what is the likelihood, of reoccurrence, and maybe you don't need chemotherapy, you might need this instead. So it means then you have an overall, I suppose, better experience during treatment, but after you've less side effects. And really that's what we want. We want to manage our cancer. We're talking about survivorship, like we want to be well. Fitness, I did another sort of a project a few years ago through the university college, and it was called Can React, and it was fantastic. It was during COVID, and they did it on Zoom, where they looked at your kind of fitness, your nutrition, and you liaised with a physiotherapist, and he sort of gave you a regime of exercises. Because with lymphedema, I was so nervous at the beginning. I was saying, Jesus, will I be able to hold a bag of shopping? Again, because there wasn't a lot of information around it or education, and therefore, like that piece, I said, is so important, because your fitness, you want to, be able to walk and do your different things, and building that into your plan with your treatment, your nutrition. And it isn't about green juices, because I remember a friend said, are you juicing mad? I was like, no, I'm not.
Again, that's a perception thing as well.
See, that's
isn't
it. And then I was there saying, should I be juicing? I had a good diet, right? I'm a good girl for eating my breakfast, dinner and tea. I do have a sweet tooth. I won't lie. I do. But my general is good. But I remember meeting a lovely nutritionist in the day ward, and she said, you know what, Rachel, go with what your body is craving. Listen to your body. And that's what I'd say. Don't beat yourself up, especially in the middle of your treatment.
Yeah. That's not the time to be denying yourself the few bits.
And you might feel, because you might taste something one day and you like it, the next you don't. You're up and you're down, you're in, you're out. So if you find something that you like, and
so it doesn't matter if it's a pork chop or a pineapple, really,
that's it? Exactly.
Yeah.
And you'll find your way. But as regards that particular program I was in was really good, because it is so important. Fitness, and being, I suppose, doing exercises and being, I suppose, told about what you can do, because you can be so afraid, and you're sore as well after your surgery, you're recovering, you do physio, but I suppose that fitness regime, that nutrition, all of that was brilliant. So they are trying to look at all of that as well.
Because as you say, it's great to come out the other end of cancer and have a good prognosis and, all is going well, but you have to be feeling well as well, and want and be able to do the things that you want to do.
Absolutely.
Without causing yourself any damage.
That's it, exactly. And you do. I mean, because, and I suppose when you finish treatment, what I would say is people come up and they go, oh, you're finished, you're well, welcome back. You often don't feel so good. And that is something I'd say to other patients. I would say be kind to yourself.
Don't rush it.
Don't rush it, because you're not actually feeling. I cried my last day of chemo. Imagine, I was inside in the oncology day ward, and I'd say they were saying, and they were like, and I said, I know, but I said, you be my security blanket here. I've come here every week. I've handed it over to you.
There's a fear factor there, Rachel, as well, isn't it? That, yes, I've come to the end of the number of rounds of treatment. But what if that wasn't enough?
That's it. And now I have to do it on my own, my body. And you're saying, and you're nervous, like you're in and out for different things. It becomes your total norm to be up there. It was our norm. We just knew our routine. We go out for our breakfast after the bloods were taken before you'd start chemo, and it became just life.
Yeah. And then, that's been taken from you now. So it's all good, but it's been taken away from you.
And then that, as I said, that security blanket. And then you're saying, God, will my body now do it on its own? Mm-hmm. And, but I have to say, oh my God, I'm so proud of my body. They can throw all that at you, all these drugs, all this, and, you can feel unwell, but my God, you just have to admire it.
It's amazing,
isn't it? The will, and just to kind of push on, and you'll find, I get emotional now, but you find such strength,
Yeah.
And like I would have said, God, Ray, I didn't think you were you were strong, but but you see, I had a great support system and network, but these are good tears.
They are good tears. And yes, you had a great support system and a great network. But if you weren't you wouldn't be as good as what you are now either. So you kind of have to trust your own body, don't you?
You do, and you have to believe in yourself.
Yeah.
And you have to believe, I suppose you do have to commit and believe that what you're being given is correct. I would always say though, research, be your own advocate too for yourself. It is hard when you're in the middle of stuff, but if you don't feel something fits right, talk to your doctor.
Talk to your oncology team.
Do, because, and if just...
So you're going to accept, their expertise and, their medical professionalism in your oncology team, but you still have to know that it's right for you, don't you?
Well, that's it, exactly. And I suppose you'd hear, I was very lucky on my hormone treatment. I felt quite well on it because a lot of people have adverse effects, and I think when I look back, maybe I had pains and aches, but I kind of said, maybe they're just pains and aches and I'd have had them anyway.
Yeah.
But we'd say some people have very tough time. And, some people would say, I'm just coming off that. And I'd say, oh, good God, now don't come off the drug. Go to your doctor and talk to them. Maybe they can tweak it. Maybe they can put you on another one. Don't decide.
But you don't do anything rash like that.
No, be careful. And, but do discuss it with your team, because if you're feeling so unwell, they might have something that can help you. We'd say, because you'd read a lot of forums, people, do kind of struggle. But as I said, communication and, keeping that line open all the time.
So, I mean, in nearly everything you've said there, communication is a huge part of it, isn't it? Being open and, communicating not just with your oncology team, but with all the various supports, as you said, Cancer Care West and the Irish Cancer Society. Yeah, so you just have to be as open as you can to everything that's out there and make sure you're informed.
Yes, well, that's it, to be informed. And it is a hard time because a lot goes over your head. So have that person with you that is at all, if you can have someone at your appointments.
Whoever it is.
Record how you're feeling, things like that. And all these help your clinicians as well, because, they can hear how it's impacting you and so forth. And, but we have so much information and it can be overwhelming, to kind of, it's just, I suppose, do what fits for you. Because as I said, we're all individual.
But as you said, and that's the importance, I suppose, of targeted therapies and targeted treatments, because it's not... it's not the measles, it's not one big generic breast cancer.
Yes. And one size fits all, I suppose, was what was there in the past, which was great because that's what they had. Yeah. But they're making, they are making progress.
Some people don't necessarily need chemotherapy. So everything is, specific to a person and to your diagnosis and whatever presentation you have.
Absolutely.
So, and again, I suppose that's, why the National Breast Cancer Research Institute is so important, I think, in terms of what it does and the clinical trials and the research that's there and how the medical advancements that has been made. Because, as you said, 30 years ago, this was a very different scenario.
Absolutely. And really, when you heard the word cancer, I remember my granny, God rest her, she wouldn't say cancer, she'd say C.
Yeah, the big C.
And, it was like you'd say life limiting and you'd go, oh gosh. Yeah. Now, thankfully, so many cancers can be managed. Not every, unfortunately. Yeah. They've made huge progress in breast cancer. And we are very lucky to have the Lamb Institute in Galway. Mm-hmm. Dr. Roisin Dwyer, now I've worked with in the last few years as a patient advocate, and she's shown me around the unit and, showing what they're doing. Like, we get the treatment, but we don't know what's behind it. And, she's all her PhD students who are just so enthusiastic and like marvellous work being done in research labs. Ireland isn't a big country, but we are really making great strides. And I suppose if we need to fund research, research will turn into trials. Trials will, obviously help patients now and going forward.
But sure, as you even said, the treatments that you were on at one stage, they were
trialled by patients before me. Absolutely. And it is a necessity, and funding is so, so important. Yeah. The Irish Cancer Society, I know, fund a lot of research in this country. And the generosity of people, they are just wonderful. You see all the different initiatives the Breast Cancer Research Institute runs, the Play in Pink, the races, and people, I suppose every family really has been touched by cancer in some way. So it's something close to our hearts. And, I know that there are some, stories that are not so good, but I suppose sharing the positive and, giving hope, because when I was having treatment, I'd meet maybe people that were coming back, say I was going in for my follow-up and you'd be in the breast unit. You might meet someone who was 5 years on and they were coming in for their annual mammogram. And you get great, bit of, oh, she looks great.
Yeah.
And then...
Well, I think anyone looking at you would feel very positive.
There's a bit of hair now and whatever done. But no, like you want to, you just want to be yourself again and feel well. And
Well, I think anyone listening this morning, should take heed of your tips that Rachel recommends. I think the practical tips were really good in terms of, as you said, looking for the wig before you start the chemo, and if you can get your eyebrows tattooed, and if that's something that you want to do, look into all that. So and again, just on your positivity and being open to everything and making sure you communicate well, and that that you take all the supports that are on offer. I think anyone listening, needs to heed all that you said there, because you are now 17 years.
Yeah, I was diagnosed 10th of December 2007, so 17 years since December. It'll be 18 this December. It's hard to believe.
Yeah.
And, I'm doing
and you
very
look
well.
Fantastic,
Thank you.
You really do. I never looked around everything, but you still do look fantastic.
Well, I feel good, which is, a great thing. And, and I must say, I love life, and please God, I'm going to be here for a long time more. And, so...
Well, I'm sure you will. Rachel, it was a pleasure to talk to you. Thank you so much for being so open. And I just think any woman listening to that can take so much out of it in terms of both the practicalities and the positivities.
Thanks a million, Aileen. No, thank you.